America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. But if you've got a question or comment, send me an email. I'll be happy to answer it, do anything I can to help you. In studio with me today, some guests from Blue Cross and Blue Shield of Kansas City. Very happy to have them here. Maggie Parker, the Director of Large Group. Welcome.
Thank you.
Your first time
Thanks
here.
For having me.
Anna Finnegan, Vice President of Spira Care. She has been here before. Welcome her back. So we're happy to have them in studio with us today. We're going to talk about a couple of things. The large group concept, what Blue Cross and Blue Shield brings to the large group market. This is a show that I've wanted to do for a very long time, and we're going to get to do it today. So employers out there, brokers out there, if you fall into the category of large group, we're going to talk about that. We're going to talk about why these programs are different, and we're going to talk about how you have access to Spira Care now, and that's another piece of this I think you're going to find very, very important. My producers today, Mr. Garner Cowdery, he's the man behind the microphones over here, and Dave Thiessen behind all the cameras, who does all of our video work and posts all these shows on our YouTube and podcast platforms. There are 15 podcast platforms. If you listen to one of the shows, like it, follow, or subscribe. It doesn't cost anything to subscribe, by the way. So if you choose to do that, please, we would love to have you. I also want to say hello to one of our affiliates in Amarillo, Texas, KGNC 710 AM and 97.5 FM. Got a nice note from them the other day, airing the show down there. I think we've been on down there about 5 years now. So hello to Amarillo, Texas. So let's start. If you can, Maggie, let's just talk a little bit about the large group offering and, what's unique about the way BlueKC does is you've got a very large book of group business, some of the bigger groups, the city, the AFL-CIO, you've got some pretty large groups in here. But start out with the size of large group and let's just go from there. Maggie?
Sure, absolutely. We'll appreciate the opportunity to come in and talk. Thanks for having us. So when we think large group as it relates to BlueKC, large group, that market segment is really our 100 plus employers. So if you have 100 or more employees enrolled on your plan, that is going to fall into our large group book of business or our large group segment. Within that segment, we have over 340 large group customers that we work with closely. The value of BlueKC really is the local presence, right? Our opportunity to collaborate with our customers, sit down with them, because we are local and we have that local presence. Our team of sales individuals is able to really help collaborate and customize health insurance plans alongside our customers and broker partners. So, BlueKC has won multiple awards, the J.D. Power Award for Customer Service, and it's something you guys have always prided yourself on. I always find it amusing when you talk about some of these national plans out there, and somebody gets on the phone and asks them, "Can you tell me about the hospitals north of the river?" And they ask you, "What river?" You know you're not talking to somebody in Kansas City. Yeah. So talk a little bit about how your customer service model blends in with large group to help the broker, sure,
okay, and to help the employer, so that the human resource director is not running back to his office going, "We're having all kinds of problems."
Yeah, absolutely.
So talk a little bit about that.
I think that's a great point. Thanks for bringing it up. So from a customer service perspective, we have a variety of layers to help support our groups, our brokers, our members. I'll start at the member level, right, where you have your call-in customer service options, or and those individuals, yes, are our award-winning customer service agents. We really pride ourselves on that. In fact, some of our corporate goals include the insurance of understanding and making sure that our members have really good customer experiences when they call in. From then we talk about kind of the broker support, right? We talk about the group support. That really falls onto the sales team, and we really pride ourselves in those relationships. We've been in the Kansas City Metro for over 85 years, and that's super important to us, and we continue to really pour into those relationships on the broker side as well as our customer group customer side.
So let's switch gears a little bit and talk about ASO. Can you define ASO for the audience, and then let's talk about that and how that interacts with the brokerage community?
If you don't mind, I'm going to take a step back and really just talk about maybe what a fully insured plan is.
Yeah.
So our fully insured plans, those are group health plans where employer groups seek out a commercial health insurer, right, to insure the plan. And then with that arrangement, the health insurance, BlueKC or other carrier, then would pay those claims on behalf of that group employer plan. In a self-funded model, BlueKC is really only hired to administer those claims. The payment of those claims really falls onto the employer group.
Are you handling stop loss for these large groups?
We certainly can.
So you do have the ability to do that?
Absolutely, yes. Stop loss is an option that we can write. They can carve in that stop loss coverage with BlueKC, or they can carve out that stop loss coverage if that is something that they're interested in doing.
And so when you talk about working with the brokers on this, is there... Do you see a lot of noise now around this whole issue of PBMs? You're laughing. You see companies like Aetna pulling completely out of the marketplace on the ACA side, et cetera, and United's having problems as well. But so talk a little bit about the PBM and how you guys handle that on the large group side and your thoughts on that.
Absolutely.
And what is a PBM? Let's start by telling the audience.
I think that's a great idea. Pharmacy benefits manager. In the insurance world, I think, as you know, there's an acronym for everything. So appreciate the opportunity to clarify that up front. So PBMs are, yes, they are the big three, the Optum, the ESI, and the CVS. Those are what we call kind of the big box PBMs. There are also a lot of boutique PBM opportunities, organizations popping up for groups to really evaluate. They have some flexibility in some of their offerings, but ultimately we are seeing the pharmacy spend for group health plans expanding so much that we now find that is one of the larger line items when they take a look at what their health plan spend is allocated for. So BlueKC, we work with Optum as our preferred PBM. However, as we move into 1/1 of 2026, for our ASO customers, our self-funded customers, as we just described, those individual groups have the opportunity to carve out to a different PBM if they so choose. The integrated PBMs that we have chosen for 1/1 of 2026 include SmithRx, Capital RX, and Med Impact. So as our customers are going to evaluate what vendor partners they want to work with in 1/1/26, that list has expanded a bit as we move toward that time.
So when you're looking at those three different PBMs, are you looking at the standpoint of they're offering different formularies? Maybe are some of them offering drug importation from Canada, New Zealand, Australia? I mean, are there some differing benefits between the different PBMs and how they're approaching it?
Absolutely. We anticipate, yes, that as groups are going to evaluate some of these PBM solutions, there are a number of formulary changes. There's discount opportunities or changes. There's changes oftentimes in the rebate mix or the rebate guarantees in which they are being promised to the group. However, I will say, Carrie, that whenever we're talking about the opportunity to carve out this line of business within our market, BlueKC isn't involved in that contract negotiation. That contract negotiation really happens directly with the group and broker and that other PBM. So oftentimes...
You're there to help if they...
100%. We want to be able to take a look at that, illustrate how BlueKC's offer is standing up, and perhaps then how to compare and contrast and really spread those different options.
Wonderful. All right. When we come back from the break, we're going to talk about the future. What is BlueKC planning for next year? What do they have in the hopper right now that we're going to hear about that's going to affect brokers and it's going to affect the large groups? We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. If you want information, go to the website BlueKC.com or give them a call at 833-467-2145, 833-467-2145. Stay tuned. We'll be right back with more. Welcome back to America's Healthcare Advocate, broadcasting coast to coast across the USA. If you want to find out more about us, go to the website, americashealthcareadvocate.com. All the shows are posted up there, plus our 15 podcast channels and our YouTube channel. So you're a broker and you want to tell somebody about these opportunities with Blue Cross, you can use the show to do that. You can also share it inside your group if you want to do that as well. And you can also reach out to the good folks over at Blue Cross at 833-467-2145. or the website BlueKC.com. All right, Maggie, let's go back and talk about, what's going to happen in 2026 and your enhanced ASO and then the integration into SpiraCare. So let's talk a little bit about those three things.
Super, thanks. As we talk about ASO, administrative services only, that and self-funded health plans, it's one and the same. When we talk about Blue Cross and what we have to offer, we currently offer an ASO product today. However, as we move toward 1/1 of 2026, we've really taken market feedback and expanded some of the optionality and functionality within our ASO product. So as we take a look at 26, we have the option now to have additional flexibility related to the PBM carve-out as we just discussed. Okay. So that is one of the enhancements that we're taking a look at for 1/1 of 26. You'll notice over the next several years, we will continue to iterate on that flexibility and the optionality that we have available to groups. So I'd love to come back and discuss with you at that point the additional flexibility options that we have. We're really looking into that clinical solution, some of those unbundling of programs to really take our administrative expenses lower and allow groups to identify what programs they want to put in place that makes most sense for their membership.
So you're looking at things that control cost of care.
Absolutely.
You're trying to hand it back to the employer and the broker, say, okay, these are some things, we're giving you 3 PBM choices. Look at the 3. Which one do you think offers the best value? How does this affect cost of care? Yeah. These are the kinds of things you're talking about, right?
Sure, absolutely. And to take that a step further, as we look at maybe specific point solutions within the market for different things like condition management, as you mentioned, controlling those costs of care, controlling the overall total cost of care for members, we are really looking at some of those high dollar options, MSK, oncology, the PBM in 1/1 of 26 is one of those areas that we find groups are really anxious and really interested in evaluating those options.
And when people hear cost of care, controlling cost of care, they immediately go, okay, they're going to take away benefits. It's not about taking away benefits. It's about doing a better job of managing chronic disease and dealing with, making sure that type 2 diabetic doesn't roll over and become a type 1 diabetic, because you've got them enrolled in a program where they're getting the A1Cs, they're doing the things they're supposed to do. Am I right?
Yeah, absolutely. We really value getting the right care at the right time. That's kind of the intent of utilization management, right? We don't want to jump to a maybe more acute care model or therapy when we could take a step approach and try other options. As you mentioned, yes, we want to make sure that those chronic conditions are controlled so that we don't have members end up in the emergency department or in the emergency room. That is really the overall idea of that cost of care and making sure that we're managing that responsibly for our members and groups.
So I'm a large employer. I've got 300 employees and I run a trucking company. And my truck drivers are all over the country. How am I going to do a Blue Cross and Blue Shield plan in Kansas City if I have 300 truck drivers and 200 of them don't live in the Kansas City metro?
You got it. So from a national perspective, national employers tap into our Blue Card network. So Blue Card is our national footprint. It is one of the largest networks with one of the most advantageous discount positions in the market. We continue to see that being a very broad network, and our employer groups have the ability to tap into that. We have our then more localized networks that we are able to do some more customization to through our provider relations team here at BlueKC. But you can rest assured that traveling outside of the metro, you have coverage through our Blue Card program.
And the thing about Blue Card that's so nice is the local Blues have usually a better network than most of the national carriers because they're the local Blues.
Exactly.
Just like you. So to be able to say to the employer, well, you're going to broaden their access, not limit their access with Blue Card, that's a big deal.
It's important. Yeah, absolutely. As we've identified, organizations have workers kind of all over the place. Post-pandemic, we've seen remote worker increase. And so that then poses the question for someone who perhaps maybe was a local company. They might have a workforce that's now outside of the area. And BlueKC is a solution for them through that Blue Card program.
Talk a little bit about the integration of Spira Care now and some of the things that you're doing there.
So we're really, really excited about 1/1/26. We have a lot of things coming, not just the ASO optionality, but as we move and look at our Spira Care program, as it sits today, Spira Care is only offered on our Blue Select Plus network. That's our high performance network here in the metro. As we move toward 1/1/26, we're excited to expand Spira Care to our Preferred Care Blue network. Preferred Care Blue network, often called PCB, is more of our broad network. A lot of our employer groups leverage this network as more maybe their buy-up network option. And we're excited to be able to apply Spira Access for those members and those groups should they choose to put that optionality in.
So that network, as an example, might have Children's Mercy in it, whereas one of the other networks would not have that.
So Children's Mercy is in both. I think it's a good distinction, right? So Children's Mercy is in both PCB and Blue Select Plus BSP. When we talk about network mix. From the Blue Select Plus side, where you really see that narrowing is in your St. Luke's facilities and your HCA facilities. So those are the two differentiators from a hospital system perspective when we talk about that broad network and that high performance network.
And the high performance network includes which hospital systems?
So it includes all but the St. Luke's and HCA.
Yeah. Wonderful. When we come back to the break, we're going to switch gears now, and we're going to start talking about Spira Care. And this is one of the best programs, primary care and mental health care programs I think you'll see anywhere nationally. Blue Cross of Kansas City pioneered this concept. How many years ago was this, Sandy?
About 8.5 when we launched.
That's amazing. I remember when it first launched.
Yes, in Olathe.
And I was like, holy cow, they're really going to do this.
Yes, it's really exciting.
This was Danette Wilson's vision.
Yes, it was.
And it's come to fruition, and it's doing phenomenally well. So we'll talk about this. We'll talk about some of the folks I know that have had personal experience with it, because it's very unique in what it offers. It's not your typical primary care clinic that you may think of, because the offerings are significantly different, and they're all over the metro. We'll talk about that as well. So we'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. If you want information about any of this, anything you're hearing about, call them at 833-467-2145, 833-467-2145, or BlueKC.com. It's all up on their website that you can reach out. You can go talk to Maggie, give them a call. They'll be happy to chat with you. Stay tuned. We'll be right back after the break with more. Welcome back to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. In studio with me, Maggie Parker, Director of Large Group for Blue Cross and Blue Shield of Kansas City, and Anna Finnegan, Vice President of Spira Care. We're going to switch gears now. We've been talking about the large group products, what they have to offer. I will tell you, I'm a 26-year recovering broker, as I like to say, and the Blue Cross and Blue Shield products in this town are superior to almost everything else that's offered out there. If you take the time to look at it, if you're the broker, you really should sit down with these folks and have a conversation about your large group client and how they can benefit them and how they can do it differently than some of the other programs that are out there. There's some other programs at Pareto, Berkeley, some of the other ones, but I think you'll find this program works significantly differently, especially with the local flavor and the fact that their customer service is superior basically to anything else in the Kansas City metro. So let's just start with Spira Care. So 8.5 years ago, this thing starts. I remember being at lunch with Danette, and she told me she was going to do this, and I was like, holy cow, this is going to be quite an undertaking to do it. And it started. So let's talk about the model where it is now from where it was 8.5 years ago, and how it's grown, and you've got different, it's really expanded from where it was when we first started. So let's go.
Oh, absolutely. So 8.5 years ago, we opened our first care center back in Olathe. I think you were there with us.
I was.
And
yes.
What is really exciting about Spira Care and with BlueKC, it is the bringing together of health insurance and primary care in a how do we help take care of our members? How do we take care of our patients? And as Maggie was talking about the goals of BlueKC, right? It's about bringing affordability in. It's about managing healthcare costs, but it's also about how we help our community be healthier and how do we redefine the member experience, the patient experience. And that's what Spira Care has been about. And so from the beginning of our first care center in Olathe in 2018, we are now fast forward in 2025. We have 9 care centers across the metro, from the Northland to Johnson County, from Wyandotte County, over in the Legends to Independence and Lee Summit and everywhere in between. Our goal is all about how we help you live your healthier life. And so it is about creating a primary care practice that puts our patients at the center of everything we do, wrapped with the power of BlueKC and your network. So it is where we started and where we are has just continued to blossom.
So, I remember the first time I walked into the Olympic Clinic, this doesn't look like a primary care clinic.
No.
It looked like a hotel lobby. I was like, the big desk back there with everybody waiting there, and then
Yes.
you go. So talk about, you go in, you're new.
Yes.
You go into Spira Care, you're going to have your first visit.
Sure.
Talk about how that works. And so here's a fact that I always find interesting. The average amount of time a patient spends with their primary care physician, what do you think the average amount of time is?
In a traditional primary care, it is usually like 6 to 7 minutes.
It's 7.5 minutes. Mm-hmm. Your first one that's ever got that right. Yeah, 7.5 minutes. That's it. She's typing away or he's typing away on the computer, and they're talking to you simultaneously, and then here's your new prescription to buy. Let's contrast that with what happens when you walk in the door at Spira Care.
Yeah, so separate from a traditional primary care that is about volume, it is about managing those symptoms, getting you in and out, and often the patient is responsible for managing all the next steps, right? You need to go to a cardiologist, you got to go figure that out. Spira Care is different. It is an advanced primary care practice, and what that means is we have a multidisciplinary care team that puts our patients at the center of the care, but we work with you to do all of the things together. So you have a primary care provider who does spend more time with you. So we have longer appointment times. It is not based on rushing you in and out. It is about seeing you as a whole person and managing all the conditions that you have. We have behavioral health consultants where we think about the whole person, your physical health and your mental health. Nursing staff that's made up of registered nurses, LPNs, medical assistants. We have diabetes care specialists, an ambulatory pharmacist, care guides that are specialized in benefits as well as care management. So we can help you manage your care inside the care centers as well as that care that extends to those specialists, and that we can help connect you from here you are at primary care all the way through your next steps of care. So when you walk in as a new patient, our job is to help you not only take care of what you have going on right now, but it's all of the steps through that whole care journey. We never want you to leave our care center not knowing where to go next, what to do next. Our job is to help simplify that and help navigate that with you and for you as you go forward.
And it's certainly going to take longer than 7.5 minutes.
Oh, absolutely it does. Absolutely it does.
Yeah, the average time, I think, if I remember correctly, is about 30 minutes. It
is.
And sometimes it's more than that.
Right, and we get feedback. We send out, after every one of our appointments, we send out post-visit surveys to our patients, and we hear consistently from them that they appreciate the time that we spend, that we listen to them, that we help care for them, navigate, take away some of that complexity that just exists within healthcare.
So let's talk about the care guides, because this is really important. You made a very interesting point earlier. You go to a typical primary care practice, you need to go see, I'll give you a classic example. My wife had a torn meniscus. We went to the primary care facility, her doctor, we got referred, we went to see the specialist, et cetera. Well, then it was up to us to decide, well, you need to get an MRI. Where are you going to do it? Well, you have to figure that out. You go take care. That is completely different than the way Spira Care works. So what's beauty of Spira Care is you're not just handing it off to the patient saying, here, that's your job. You're actually sitting down with them and saying, here are the facilities you can go to, here are the doctors you can go to. Talk a little bit about that, because I think that's critical for people.
Absolutely. And our care guides we love them, and they are fabulous. Our patients love them. And your example is a great one. If a patient has a torn meniscus and we need to send you off to specialty care, and we'll sit down with you, and this is where the power of BlueKC is so impactful for us, is that we can help you identify where it will be less costly for you as a patient. So we think about the total cost of care, that there are some locations that will cost less or less expensive. We'll help you find a specialist in network so you're not paying out of network rates. We'll look at where you live, and we will help you navigate those referrals. We'll even work to make sure that if there are medical records that need to be sent, we will help that.
You don't have to go get your own medical records and take them to the doctor's office?
We'll help you with those things. If we take an x-ray and we need to transmit those x-rays to the specialist, we'll handle that for you. So there's a lot of places where healthcare is just broken and fragmented. So one of the things that we continually work on and try to innovate in is where can we bridge that fragmentation?
And that's what you're doing.
Yes.
And so someone has a procedure done, a surgical procedure, whatever the case may be, your team is following up afterwards.
Yes.
We talked about this a minute ago when we talked about not having to go in. One of the biggest problems with care is if someone has an issue, they the first thing they do and they have to do a readmit is they're right in the ER.
Yes.
So talk about how your team follows up if they need in-home care, whatever the case may be.
Right. So after a patient comes out of the hospital, we follow up with them. We try to get them back into our care centers so that we have an ambulatory pharmacist who works with the provider and the patient to help reconcile some of that medication. Because oftentimes when you come out of the hospital, you have a list of medications that they have prescribed that may be similar or different to the medications that maybe a patient has been on. And so they're sort of confused of what do I take from the hospital to what I've been taking previously. Sometimes there's follow-up appointments that are needed, care that is needed, to your point. So that's where our care guides come in, and that's where our staff comes in. So we will proactively reach out and bring those patients in. We've also set up a program of Call Us First. So anyone who has questions about their health, call us first for life-threatening emergencies, right? If you're having a heart attack, you need to call 911. But if you wake up and not feeling well, or you're concerned about something, call us first. Our triage nurses will ask you a series of questions, triage those symptoms, and if you need an appointment, work with you to get you scheduled the same day, next day.
So now I'm the employer, and I'm going to offer Blue Cross and Blue Shield to my employees. But if I offer Spira Care to them, what I'm doing, there's two things that are happening. Number one, the satisfaction level of Spira Care is really superior. I've seen the surveys. It's really quite remarkable. Number two, you're helping the employer with cost control.
Yes.
Because instead of sending them out to get a $3,000 MRI, you're sending it to a standalone to get the same MRI for $700. So those are the kinds of things that I think resonate, not only with the employer, but also with the employee, because the employee experience, as you talk about, the member experience,
yes,
is what your focus is.
Absolutely it is. Absolutely.
And that's what makes the difference.
It's wonderful, yes.
When we come back from the break, we're going to talk about a program that Anna mentioned. And I've talked with Ryan Lefevre about this. You probably see him during the Royals games talking about it. We're going to talk about the offer of mental health care in Spira Care, behavioral health, how they do it, why it's different. Okay, you won't find this in other primary care clinics, and who can benefit from this. So stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA radio network, coast to coast, across the USA. If you want to give Blue Cross and Blue Shield a call, 833-467-2145. You want to learn about Spira Care, you want to do something your employees are going to really be happy with, find out about Spira Care. You'd be surprised. Or you can go online to BlueKC.com. We'll be right back after the break. Stay tuned. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. All these shows are posted on our podcast platforms, 15 of them. So if there's a podcast platform out there, we're probably on it, from Rumble to Spotify, you name it, we're on all of them. And on our YouTube channel, americashealthcareadvocate.com. So if you want to tell somebody about SpiraCare, this program, they can go up and actually listen to the program. You don't have to be able to recite everything we talked about here. That's a great way to do this. My producer in studio, Mr. Garner Cowdery, and Dave Thiessen, always doing an excellent job. In studio with me, Maggie Parker, Director of Large Group, Blue Cross and Blue Shield of Kansas City, and Anna Finnegan, VP of SpiraCare Clinics there. How many of them are there? 11?
We have 9.
Nine
of them.
See, I keep trying to get more.
I know. Yes, every time.
9. So I have to tell you a quick story. So there's a local broker here years ago when this first opened, and his name's David Hickman, and he had a large group, and we were heading to Arkansas to meet with some legislators in Arkansas about something. I can't remember what it was, and he was telling me about this group, and he was having trouble making it work and getting. I said, well, why don't you take him over to SpiraCare? So he did. He found out about the program, thought it was great, did it. Calls me up 2 weeks later. He goes, I just enrolled the whole brokerage in SpiraCare. So not only did he do it, but he enrolled his entire family plus everybody in his brokerage in SpiraCare. So his son goes to one of the SpiraCare centers to get something done, and they couldn't do it there. They had to send him to another one. They gave him a gas card.
Sure.
He thought that was the greatest thing since sliced bread, that they gave him a gas card to get him from one SpiraCare center. So when you talk about personalized care, that's what I'm talking about, okay? That's why it's different. And that's why I would urge you, if you're a broker or if you're an employer, to take a look at this. If you're on an ACA plan, whatever the case may be, it's worth taking a look at what SpiraCare has to offer. So there is a crisis in this country on mental health. You know, Ryan Lefebvre has come on this show on multiple occasions. We've talked about this, his journey. You see him on the Royals broadcast. One of the unique features of SpiraCare that I think is very, very different is you offer behavioral health.
Yes.
And it's right there. So, so someone has a death in the family, they need bereavement counseling. They're coming in, they're having physical problems. They can go right across the hall, down the hall, and see a behavioral health specialist. So talk about that. I think that's one of the most unique offerings of SpiraCare versus any other primary care clinic I've ever seen.
No, absolutely. And I'm so glad you brought this up. So as I talk about SpiraCare, and we take care of patients from babies up to seniors, right? And everywhere in between. So we take care of the whole family through all ages. The integration of behavioral health was very intentional from the very beginning. And it was all about, we want to take care of the whole person. And we know that your physical health and your mental health are intertwined. And whether you have a new diagnosis, whether you have a death in the family, a new life event, all of these things impact your physical well-being. Your physical well-being impacts your mental health. All of these things come together. So the way sort of operationally it works is you're having your appointment maybe with your provider, and you're talking about what's going on. Our providers will do warm handoffs right there to the behavioral health consultant. They'll bring them into the room to meet with the patient. The behavioral health consultant will set up an appointment with that patient as a follow-up to make sure things are going well. They'll provide interventions of, okay, let's talk through what's happening, and here's some things we can do to help you navigate this event that's happening, or this diagnosis you're dealing with, or okay, there's new medications you have to take that may impact your lifestyle. So let's talk about what that means. It's really important that we bring these things together and it's not stigmatized. And that's so much of what we're dealing with. It's what Ryan's talks about. So how we bring that together is, whether you're a young teenager who's dealing with things, as you're an adult, a parent, all of these things, we do it inside of SpiraCare as part of that just integrated care that we give every single day.
And we're seeing more and more young people dealing with mental health issues. A lot of that has to do with these damn things.
Sure.
Okay? And the amount of time kids spend on this. And then social media and all the rest of it. So talk a little bit about how, this is not just for adults.
Yeah.
You can bring children there. A child doesn't really want to talk to their parents about it.
Right.
But they will sit down and talk to somebody else about it if they get comfortable. So talk a little about how that works and how that can help the parent deal with that issue.
Right. So, we encourage everybody, the value of primary care is to come to us for your annual checkup, for your annual wellness. And that sometimes when these things come up, and our providers are good at asking those questions of the kids and kind of pulling those things out, asking them about some of those lifestyle questions about how much time do you spend? How are things going? What's life like? All that stuff. I got 2 teenagers. I know what it's like.
Yeah, I've got 6 grandchildren.
Yeah,
trust me.
Yeah, you get the spectrum. Some are talkers. Some are.
The good news is I can give them back at the end.
100%. You're lucky. I can't.
That's revenge.
There you
But
go.
anyway,
There you go.
yeah.
But it is, and we have that support. And if a parent is concerned, they can bring that up to the provider and say, I'm a little concerned about my kid. What can we do? I'm the parent. Can you help us with this? And so we'll work with the parents and the kid. So it really is a team effort to come together and come up with those strategies to support.
So, and here again, the employer, the employee, the member, instead of having to go out and find a psychiatrist, psychologist, behavioral health specialist, and try to get in to see them and go through all of that and then pay for it out of pocket, you're part of Spira Care. That's all part of the program.
Right. And if in this process we find that we do need to connect you with, maybe you do need some additional specialty care in that behavioral health space.
But you're going to get them in.
We're going to help you. We're going to help connect you, just like we would if you needed to go see a cardiologist. That's part of that value, that connection of care. We're not going to leave you hanging to go navigate on your own.
So you started out back in the day with about 2,500 members. And today, it's over 70,000.
That's correct.
It's pretty amazing.
Yeah.
That says something. You don't get 70,000 people in a program like this because they're not happy.
Right.
When you've got 70,000 people in a program, you're doing something right.
Right.
So what are the plans? Are there plans for more facilities? Or are we topped out now? Where?
So we have capacity in our care center, so we constantly monitor to make sure that we have access, right? We want to be able to get patients in.
They don't have to wait 30 days.
Oh, no, absolutely not. And that's part of, we want to get you in for the care you need when you need it. So we constantly monitor our metrics and access across the system. And we're constantly looking at and working with sales to find out, where are new groups coming in? Where is the membership? Where is the community growing across Kansas City? And so we'll continue to evaluate that as time goes on. And if we need to look at further expansion, well, then I'll come back to your show and I'll tell you where we're.
That would be great. We'd like to have you back.
Absolutely. I'll come back and I'll tell you where the next one's going to be.
Thank you both for being here today. Great show, great information that was out there. I really appreciate you taking the time. I've been a broker, like I said, over almost 30 years now, and I've been a Blue Cross and Blue Shield member about the same amount of time. I've never left Blue Cross and Blue Shield. The care in this town, the way they do things is significantly different than the other carriers. And if you're a broker, if you're an employer or you're an individual, I urge you to take a look at their products and what they offer. Spira Care in particular is a great program. If you want information, 833-467-2145 or BlueKC.com is the website. And now I leave you with this thought from Dr. Martin Luther King. We must learn to live together as Americans, as brothers and sisters, or we will surely perish together as fools. Truer words are never spoken. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.